Hi, this is Adrian from Step Up for Mental Health, and you're on Mental Talk. Today, I'm going to talk a little bit about 2020 and just kind of what do we have? The day on this podcast is 12/15, 2020. The day in Chicago was the first day that one person, I think five, got vaccinated on the first kind of vaccine. And people are kind of in an interesting place. So 2022 was all about the pandemic. We went through a lot of things. As a small organization, Step Up for Mental Health, we fed a lot of people. We're feeding more people next week. We're going to be at a kind of food and swag bag event on December 19th. Hopefully, this gets published then. Um, and our goal really was to, March happened. We knew we had to pivot because our helpline was getting overrun with calls about not having enough food to eat. And so that was our mission this year, where we were going to do something totally different. And then we're like, okay, we have to beef up our helpline. We also um, was on a mission to get 20 content writers. We got close to, so we got 17. And because as a person who's dealt with many, many types of things, stress, situational depression, anxiety, all those type of things, I knew that we needed to talk about stuff that was coming. And that was in March. When I say I started thinking about it, May was when we initially started to seek out new uh, volunteers who wanted to come in and talk about their own struggles, talk about um, things that they've learned and seen. A lot of people were talking about on our websites dealing with the pandemic, going through the pandemic, and now we're kind of on the coming from the other side. Now, keep in mind, we have about another year. I mean, yes, we got the vaccine, but we have a lot of people who for 9 months haven't worked, maybe going through a lot of stress at home, dealing with their children and work at the same time, or not working, looking for a job. We had people who were new to being seniors, and they most likely were not going to get another job in their lifetime. Transitioning people to think about that. Um, and, you know, a lot of things were happening. So we knew that we were going to have a lot of calls in with our small grant program, which is Step Up for Small Grants. And sure enough, people needed diapers, people needed food, people needed help paying for medication. And it was stressful. Don't get me wrong. We went through a lot of things since from March. Really, a lot of peak things happened in May, all the way to September. I think where people kind of was stressing out a little bit, didn't know what to do, didn't know where to turn, didn't know where resources to get to. And that's where with our helpline, we help people navigate systems, things that I had to go through years ago when I lost my job for 2 years and couldn't find anything during the kind of economic bubble that just kind of crashed. And so I wasn't so worried as much about what was going to happen. I kind of been through that in my life before. The worst feeling you can imagine, kind of losing everything or not finding a job, things like that. And that's what people I knew people were going to go through. So my goal was to okay, let's make sure that people we can small grants. I mean, our small grants. We were trying to get like we were trying to do a smaller number this year. We're like, oh, let's go 10 people more. Ended up doing like 90 people more, but my goal was really to focus on some of the emergency things. What do we need to do as far as what the calls? The calls were don't have any food to eat. The calls were I need to talk to someone. I need one-on-one. We have one-on-one peer chats for 4 weeks. Now we kind of upgraded it 4 weeks or 8 weeks. And then just talking to somebody one-on-one, 1 hour a week. That was something I felt that people needed. And then, medication. I mean, mental health, medication go hand in hand. And we needed to make sure people had their medication or could, afford their medication. So we did that. We help people with, basic needs like women products and diapers and adult diapers, all those things that people didn't realize that when you can't go outside, when you're stuck, when you have an immune system that is compromised, that it's not as simple as just kind of going to the store and that, a little bit before the, people said wear a mask. Though my husband has disability, so we kind of was doing the mask thing as soon as we heard about it, and we started quite early. Was it March, um, April, maybe April, beginning of April, and so, but I think I said it earlier that is this going to be a time where people kind of step up and realize that, oh, I can lose everything too, or I can go through some major stuff too that I didn't think about. And have seen a lot of people kind of move forward and like helping, volunteering, really thinking about others. I didn't think we were going to, you know, I know if people were people going to step up across the you know nation and think about others or kind of uh, go into their own mind and kind of think about me. And I think it was no, I think it was a mixture of the two. For the most part, I think people did rise to the occasion, which I believe in humanity. I think that most people are great in kind of helping others when they might be better suited. They might be in a better position, and it could be even just a little slight better position. I find that people who are in need themselves tend to be very empathetic for others. I know for me, when I lost everything, it was 2010 to 2012. Um, I didn't, I thought about it because I was always hungry, as a younger child who had a mother with schizophrenia. So of course I know about poverty and all that kind of stuff, but, I was doing pretty good in my, 20s and my 30s and, um, late 20s and then 30s. And so I kind of forgot about some of the stuff that was more important. And so when you kind of lose everything, I think that was just me reflecting. When I lost everything, I always have to use the I statement. I think you kind of like reflect what's really important. Is family important? Friends important? Do you need all that stuff? Can you get by than what you thought you could as far as bigger, better, brighter? And I feel like sometimes people kind of reflect and think about doing. something different. And so I'm curious to see what 2021 is going to be like. Are people going to kind of go back to their thing, their jobs? Are people going to be thinking about why should I go to work? Why can't I just work from home? I'm a person who believes that, I like the 3-2 way of thinking where, you work for like 3 days somewhere and then work from home for 2 days or opposite of that. I tend to work best that way. But people now, everybody had to kind of learn it for the most part. Not, people not, uh, workers that really had to be somewhere like hospital, doctors and nurses, that kind of stuff. But I think that we will see a lot of things shifting. I don't think it's going to go back exactly. We have a long way to go still when it comes to just the average person taking the medication, and not to talk about we've already seen a little bit of the haves having special medications that we can't get, or so we're thinking about you know countries like America, countries like England, they're gonna get their Canada's gonna get their people the medication, but this is a global issue. And so, what about Sudan? What about Mexico? What about those countries and cities and um, continents that might not have all the resources? I mean, this is a global thing. We have to help everyone across the board. And so I'm interested to see how it's going to play out next year. I think yeah, I've been saying all along, it's going to be third quarter 2021, where um, people, the everyday, like me, the everyday person, is going to be um, finally getting the medication. And then let's see how it goes. I don't know. But I'm hoping, I'm really hoping that people rise to the occasion and um, kind of see that we're all in this together. I'm looking forward to the country moving forward with not political, but just you know less chaos, less division, less hate. I would love to have that, and um, boring would be good. You got a president or vice president and a cabinet where it's just kind of just doing their jobs and getting things right and getting everybody vaccinated and getting back to life. And so one more year we got. I'm pretty sure we have one more year. But again, it's going to be an interesting one, helping people, seeing how families fare with the stress that might be triggered in 2021 after a lot we did. I mean, we saw a lot of talk about young people disease, um, where they suffer a lot. I mean, children, you don't realize how much uh, this, talking from the I statement. I'm not, of course, not a therapist. I'm a person who just lived in the household of mental health from since I was a baby. And trauma, when it comes to transgenerational trauma, whether it's racism or just trauma living in poverty, for example, it really kind of has an impact on you, I think. And so this is 9 months. I mean, we have a lot of children who didn't hang out with their friends. I know that's kind of, people think it's weird, but social issues, social structures of people really interacting. We know that the younger children were not having a good time working from or going to school from home, that it was actually a bad thing for them. Older kids fared a little bit better, zooming and working with their phones, but young kids really need the interaction of peers in classrooms and stuff. So I'm looking forward to seeing if it's going to be kind of temporary and we'll kind of get past it in the next couple of years, or would it be something that's kind of like going to stick with us? But I overall, I think I'm talking from the nonprofit point of view, that people did rise to the occasion. Even larger companies did some things that kind of had to pivot and think outside the box, even in technology, with our partner Google. I mean, just Zoom kind of got the head start of by just being announced that this person was using Zoom, and that kind of just exploded. And then other organizations have to step up and kind of think about that. But it's going to be that way now more than ever, that people are going to be interacting across the globe. Maybe people won't be traveling as much. Definitely, I'll be going back to my 2.5 years in Japan where I lived, where I didn't even handshake anyone. So I think that's going to be something where I believe we're going to be missing hugs, but I think people are going to be more conscious. I'm hoping more conscious of how we should wash our hands. I mean, like Eastern countries, always when people have colds and that kind of thing, or um, flu season, they wear masks, and so maybe that's going to be something we're going to do in America. I don't know, but when you have a cold or flu and you're not feeling well or you just got over it, maybe you should be wearing your mask. And that's just going to be a standard thing. Maybe it's not. I don't know. But um, I feel um, like I said, people kind of rose to the occasion and helped neighbors, and I really liked that and appreciated that. And so I think now we're ready to have like a normal life, go back to movies. I miss movies. I miss having dinner with friends or brunch with friends. I used to have like every 2 months. And so soon, maybe not beginning, not half of the year, but maybe at the end of the year, 2021, we're going to get that back, and it's going to be like glorious, kind of like when you were younger and you had a you were on punishment because you did something stupid and you were like grounded for a week, and then when you got out, I remember this. You got out and you kind of like with this freedom of like, oh my god, I'm outside again, I'm free to roam the castle. So I think we're gonna all like, when we get to go to concerts or when we get to go to the movies, have popcorn, go to have a nice baseball game or hockey game, or with people. I think it's going to be a great celebration, and so I hope so. But I just wanted to say to everybody who has helped step up for mental health, uh, as a small nonprofit, 4 years, but it's tiny compared to nonprofits. I want to thank you for um, either calling our helpline and reaching out and getting help and support, or you know, or just wanting to volunteer and maybe in a different, unique way, on the front lines, maybe when you're passing out food to someone, a box of food, or making sure somebody had a bus pass, child or a college student had a bus pass, and safely 6 feet distancing, masks, gloves as always, um, or just writing something about mental health that sparked somebody's interest to think about it and talk about it. These things matter, and so I want to thank you for checking us out, watching what we're doing, growing, of course, as we do, and thinking about mental health. Till next time, talk to you later.